So the CCS program is a program that's across the lifespan. So it not only serves children, but it does serve adults. So there is really no transitioning. You're just in the program, both before 18 and after 18. And like the other programs, you need to have Wisconsin Medicaid, and there is a functional screen that you do need to pass. You need to be a resident of either Bayfield or Ashland County and have a mental health or substance use diagnosis that a doctor will verify. And the other thing is, this is for folks who need more than like outpatient therapy and psychiatric outpatient, and less than people who might need a group home or an institution. So it's really helping those people who are right in the middle. It's individualized, it's person-centered, and so it is a voluntary program. The things that we offer, and most of our services are in the home or in the community. And then we do help, and we do attend IEPs and those kinds of things if the family or the child wants us to. Other services that we offer are mentoring, social development, so it's helping people learn communication skills, how to get along with other people in social interactions. Coping skills can be a big one for folks around anxiety, depression, even what to do around thought disorders. We also provide individual therapy, and for parents or guardians, we also do what we call psychoeducation. So sometimes just learning about your loved one's mental illness or substance use can be very helpful. We also do medication management. So with the doctor's order, we will provide, we will have an RN who will sit down and pack side by side with somebody. And the goal in all of our services is for rehabilitation focus. So we don't do for people, we do with people. And so we're teaching them the skills that they need to have a quality of life and to be as independent as they can. And so our nurse will sit down with them, make sure they understand their medication, and make sure they have information on side effects. The nurses also do some assessing of side effects and how well the medication is working, and they can also coordinate that care with your physician or your psychiatrist. And then again, with that order, we have done up to 3 times a day med observation, where we go to the person's home. And a lot of times this also happens in the school. So if it's a weekend or a holiday or the summer vacation, with enough notice and with the doctor's script, we can be providing that medication at home that the school was providing, for example. We also help people in taking a look at their physical health, doing some education, support monitoring. Might be around exercise, might be around eating. Folks who have diabetes, if the mental health issues or the substance use issues are getting in the way of them taking care of themselves, that's something that we take a look at. Again, there's substance abuse treatment. We do a lot of crisis planning. When you come into the program, we develop a safety plan, and then we coordinate as needed with other agencies to help you provide that support when you're in crisis. And then assisting you with setting up any other supports you need. Sometimes, especially not so much for families, but you know, when you some of the things that we might take for example for granted, like making a dental appointment, making a doctor's appointment, those kinds of things, we can have somebody sit down side by side, show them how to do that. There's a non-emergency medical transportation service for any MA appointments, like a doctor appointment or a dentist appointment. We have somebody sit down and help them figure out how to use that system. You know, just some of these basic things of helping people become as independent as they